Some of the key considerations that we think about when we're working with kids and sharing this medical information is how old are they? What do they already know? What are their developmental needs? Is there any neurodivergence? We're also wanting to know about how do they usually cope with hard information? What's their coping style? Do they like to seek out information or do they try to avoid? We want to know their temperament and what to expect if they're having a hard time so that we can look for some of those behaviors or cues. We also want to talk about what is the best way to speak with them. Maybe it's not having, a discussion as much, but it's using manipulatives, it's using pictures. And so we will take all of that information into consideration when we're trying to figure out the best way to reach this child. Some practical tips for families who are going through a cancer diagnosis and sharing that information with kids is we highly encourage open, honest, developmentally appropriate communication. Break it down into, what they need to know, providing information little by little, even if you're unsure. A lot of families will want to wait until they find out a definite plan of care or know what's going on before they share this information, which is okay. But we also want to encourage it's okay to tell your child that you don't know, and that when you know, you will fill them in, and when they have questions or worries or concerns, if you don't know the answers to those, you can ask your doctor or your care team.